Okay. Okay, so the topic for today is dengue. So dengue fever, as we all know, is very common in the Philippines or Asian countries and countries that are in the tropical region. So like when you say tropical countries, we refer to Latin America, Brazil, Paraguay, Argentina, etc. But dengue fever or dengue itself is very common in Asia, where the hygiene or sanitary practice is very low. So, according to the latest statistics of the Department of Health of the Philippines, dengue is considered as an all-year-round disease and it's no longer a rainy season disease. But the increase of dengue patient, you will see the chart, dengue patients are normally admitted or increased in the months of July, August, September, or sometimes up to October. Although this is a yearly or year-round disease, I would like to emphasize that the mosquito in particular that harbors the virus slowly reproduce during cold season. So during January or December, January and February, they they um, they have a low possibility of mating and also breeding. Okay, let's start. So the dengue fever, aside from the word dengue fever name, is also known as the breakbone fever because if you have dengue, characteristically you will have the myalgia or muscle pain. Hemorrhagic fever because after being exposed to several serotypes of the virus, you will have hemorrhage and at the same time low platelet count. It's called also as Dundee fever because this was first isolated in the river of Dundee in Indonesia. It is the sixth most common cause of fever of viral origin. So why is it the sixth? Because if you're going to gather all the data or all the data for fever of viral origin, dengue fever ranks number 6. The top one is your influenza. Second are your viral pneumonia. So the most frequent in the tropics, I already mentioned this, especially in Asia. The Philippines ranked number 3 in the most number of cases of dengue, especially in the rainy season. Number 1 is India. The second one is Vietnam. It has a mortality rate of 12% to 100% depending on the strain that is involved. So we have 4 types of strains which will be discussed later. And the mortality rate is as low as 12%, which means out of 100%, 12% of these patients will die, or sometimes up to 100% if they are also infected by another strain. So with regards with the vector, it is transmitted by the female Aedes aegypti. So they have several species, also the Albopictus, Polychinensis, and Scutellarius. So the most common is the Aedes aegypti. So this one is a day-biting arthropod mosquito that lays eggs on stagnant and semi-polluted water. We all know that this one or this mosquito breeds on stagnant water. When you say semi-polluted water, this is not those with the mud or the black water that you see in your what do you call that in Tagalog? Estero. Okay, so you do not see them or breed there. So normally they breed in semi-polluted water. So highly polluted water is very toxic to the mosquito for breeding. So resistance to common insect repellent is reported in Brazil and Africa. So let's just hope that the strains of these insects will not go to Asia. Once they go to Asia, that will be a very big problem. So when you say insect repellent, you have your Baygon, okay? And the other brands of insect repellents, this mosquito is considered resistant, which is reported to Brazil and Africa. So studying the vector of the dengue fever, let us just concentrate on 3 parts of the mosquito. This one, and also the main thorax and the abdomen. As you can see, the abdomen of the mosquito consists of 1, 2, 3, 4, 5, 6, 7 layers of abdomen. So in short, the mosquito has to fill every abdomen of blood for the mosquito to be satisfied. So looking at this portion of the mosquito, this is where the saliva is being this is where the saliva is located, here in this portion. So once the mosquito stings, it will secrete the saliva, which is 90% dangerous because 90% of the saliva of the mosquito contains the dengue virus. Okay, the saliva of the mosquito is used for lubricant, as a lubricant. So before it sucks blood, it spits. Okay, so once it spits, the virus is there, so the virus will circulate in the blood, and that's the time the mosquito will suck blood. Okay, so this is a very good image or very good picture of your the Aedes. As you can see, it's already full of blood. So during the extraction of blood, so the virus is already inside the patient. The reason why we call this tiger mosquito, because of the line that is found in the legs of the mosquito. That's why it's called the tiger mosquito. Vector facts: female mosquitoes are the only one that feeds on human blood. No male mosquito feeds on human blood. Their main purpose is only to have, what do you call that? Gerger. That's their main purpose. The male only mates with the female, and they do not feed on human blood. So the female mosquito is the only one that feeds on human blood. It has a lifespan of 4 days. Both female and male mosquito has a lifespan of 4 days, but the female can last up to 2 weeks upon feeding on human blood. Okay, I already said it's known as the tiger mosquito. So if you have this sound, that is a female. When you sleep at night, right, you will hear some buzzing sound of mosquitoes. That is the female. That is a female mosquito. Whether it is Aedes or the common house mosquito, it is the one, or the female always makes the sound. Yeah, just like in real life. Female are more noisy. Yes, volunteer? So, with regards with the virus, we have to concentrate mainly on the virus. So, this virus belongs to the Flaviviridae, and it is under the Flavivirus and Arbovirus group. Always keep in mind that the Flavi and Arbovirus group, or the arthropod-borne virus, these are hemorrhagic viruses. So, if you are infected with the member of the Flavivirus, you will surely bleed. Best example of this one is your Ebola virus, which has a mortality and morbidity of 100%. That means if you have the Ebola virus, which is under the Flaviviridae, you will die of bleeding. Okay, so the dengue virus again belongs to the Flaviviridae. So remember, all viruses belonging to this family are also known as hemorrhagic viruses. So with regards to the nucleic acid, so we all know that viruses have are divided into two: the DNA viruses and the RNA viruses. So the virus, the dengue virus, consists of the single-stranded ribonucleic acid with a large protein coating on the capsid. So the protein of the virus is made up of several antigens. Okay? So take note of this one, the NS1 antigen. So aside from the NS1 antigen, you have these other proteins that are found in the coating of the capsid of the virus. Okay? So these are the main serotypes of the dengue virus. V1, V2, V3, and V4. Means that you need to be infected 4 times before you develop antibodies against the virus. So you have to have 4 dengue episodes in your entire life to develop the antibodies against the virus. If you are still alive, of course. So this is the electron electron microscopy picture of the virus. This one, oh no, sorry, I thought this that one. So these small particles are your dengue virus. Okay, I think this is from the spleen. So this one is also the dengue virus, dengue virus, dengue virus. Okay, it is very hard to culture or grow this virus in your tissue or in your artificial tissue culture. So this is a cartoon sketch of your virus. So the NS1 antigen is actually located here in the spikes of the virus. Okay, so this is the electron picture, and this is the a good picture also of the virus. So if you're going to slice it into two or slice it at the middle, this is the outer portion or the main structure of the virus. So to understand further, this is what it looks like. Okay, we should concentrate primarily on the protein spikes of the virus and the capsid. Okay, so I will discuss to you later why these things are very important. For the pathophysiology, the virus enters the body through the bite of the vector. Sorry for. It's very hard to speak in English. Anyway, like you when you talk to me. So the virus enters the body through the bite of the vector. Okay, I already gave you the picture. So the virus will circulate in the blood, of course. And where is that? Enters the WBC and multiplies. So the main target of the virus, unlike other viruses, for example, hepatitis B, once they go inside the body, they go directly to your hepatocytes and stay there for quite some time and takes the opportunity when the immune system is low. That's the time they will do or make cirrhosis and HCC or hepatocellular carcinoma. So I have a very good question later, which is Rizzi is already sleeping, sorry. So virus enters the WBC and multiplies. So the main target of the virus, like other viruses, is the WBC.
General.
I'm sorry?
General WBC.
Yes. So the WBC produces protein that activates interferon, which will lead to your symptoms. Okay? So just a basic virology, this is the viral pattern of all viruses when they enter the cell. So as you can see their attachment, they use their viral spikes in order to attach to the outer portion of the cell. In this case, for example, this is the WBC or hepatocyte or your neurons, etc. So once they attach themselves, they go on the process of endocytosis. So once inside, the virus will release its capsid. And the capsid will go to the ER or endoplasmic reticulum or any part of the cell, particularly the mitochondria, which is considered as the powerhouse of the cell. And at the same time, they use the ATP or the adenosine triphosphate in order to reproduce another strand of their RNA, which in return will produce their siblings or their children or the new form of viruses. So during this process, the cell that is being infected is already destroyed or dead. So once the viruses know that the cell is already dead, no more use, okay, we have to release ourselves from the cell, and the cycle will go on and on and on. Okay? So for the signs and symptoms, so once they infect the WBC will secrete your interferons, which leads to your signs and symptoms. So 100% of patients with dengue fever, of course, will have fever or pyrexia. So always remember the pyrogen, which is responsible for fever, is also released during what? During the release also of your interferon, which will signal to your brain, and your brain will signal your, what is responsible for the pain? Pain receptors? Children?
Starts with the letter.
It's as simple as this, okay? So WBC is infected. It will release interferon. The brain will signal your body to produce pyrogen, which will increase your temperature, and that's the time you will have fever. So what is the pain receptor that I was saying? Ayo, mamma mia. Anyway, you have to research. 93% of patients will develop headache, of course, because of high fever. Rashes, 76% of patients. 90% will develop myalgia or muscle pain. That's why it was called breakbone fever. Vomiting, 78%. Bleeding, 45%. Retroorbital pain, 98%. Wait. Let me go back to this one. So the retroorbital pain, I highlighted this retroorbital pain because if you're going to see fever, headache, rashes, myalgia, vomiting, bleeding, these are common signs and symptoms of viral and bacterial diseases. If you're going to concentrate on viral infection, you have fever in patients with influenza, patients with myalgia, patients with 93% will also have a headache in patients with influenza, also with myalgia, vomiting in the case of gastrointestinal infection due to your rotavirus. Bleeding is also present in some viruses. But the most common, which differs from the other, is your retroorbital pain, which is only present in dengue patients. So when you say retroorbital pain, your eyeball is very painful. So when you look up or the other side or down, there's this pain, which is like considered as also as a muscle pain, which affects the retroorbital muscle. So that is the only symptom that is present in dengue patients, which is not present in other viral infections such as respiratory viruses, such as influenza, RSV, etc. So you can differentiate it. So the next time you will see a dengue patient, does your eyes do you have pain or the retroorbital pain? So if they say yes, so those probably that is a dengue.
Sir, are they present in all strains of dengue?
Yes, of course. When you say dengue, all strains V1, 2, 3, and 4, these all causes dengue. Okay? So I think one of the practice in the emergency room in the Philippines is the tourniquet test. Sometimes, of course, from the word itself, tourniquet, sometimes they use the rubber and the sphygmomanometer. So you put pressure here, right? And then after 5 or 10 minutes, you release and you will see petechiae. That is also present in other viral infections. If you have flu, you can have petechiae. So that is not a very good primary tool in diagnosing dengue. Complications, critical phase, of course, you have the hypotension, pleural effusion, gastrointestinal bleeding. So we will concentrate only on these three: hypotension, pleural effusion, gastrointestinal bleeding. Hypotension will lead to death, of course. Pleural effusion is the presence of liquid in the lungs. Okay, so ascites also for the gastrointestinal tract, and of course one of the main complication of dengue fever is gastrointestinal bleeding. So there are certain ways how to grade an illness or dengue. Grade 1, positive tourniquet test, low platelet, and increased hematocrit concentration. So this is the typical dengue, classic or the classic dengue symptom. Okay? Grade 2, all grade 1 plus spontaneous bleeding. Remember, grade 1 and grade 2 are controllable. So this probably is caused by one strain of dengue. It can be V1, V2, V3, or V4. So V1 to 4 can cause grade 1 and grade 2 illness. Okay? Grade 3, grade 2 symptoms plus hypotension. And grade 4, of course, profound shock and death. So if your patient will be infected with, for example, V1, and at the same time it was bitten again by a mosquito that carries the V4, all in one, you will lead to grade 4. Do you get what I'm trying to say?
Yes.
For example, you're in the hospital confined. You have the grade 1 symptom because of dengue V2. And then here comes another mosquito that will bite you and carries the V4 or V1 or V3. Remember, a single mosquito carries only one strain, not two. Okay? For example, you carry V1, I carry V2. You beat him, he will develop the grade 1 or grade 2. And then I will bite him, that's the time you will have the grade 3 and grade 4. So there is a demarcation here, or a line here. This is treatable, this is serious. 3 and 4 are serious. If your patient will develop grade 3, in the morning, for example, you talk to her, at the evening she's already dead, or the next day. Okay? For the laboratory diagnosis, this is our main concern. Full blood count, or CBC, we all know what we detect there. So what are you going to see in your full blood count? You have leukopenia, of course, since this is a viral infection. Since the virus destroys or attacks the WBC, it will produce leukopenia. Thrombocytopenia, again, is
Low platelet.
praise God. Thrombocytopenia means low platelet count. Hyperhemoglobinemia, of course, the hemoglobin is increased. Do you see that in patients with dengue?
Yes.
Increased hematocrit count. Okay? And also, the main, sorry, these are just bench top. When you say bench top, this is a general test. Okay? It's a bird's eye view. So, I do not recommend CBC actually for the primary diagnosis of dengue. Because if a patient, for example, is suspected to have dengue, it should be, actually, sorry, this one is a characteristic of viral infection. That's it. Okay? There is a particular respiratory virus, is the, I think it's the RSV, sorry, I'm not very sure. The respiratory syncytial virus can also cause hyper and increase hyperhemoglobinemia and increase hematocrit count. Okay? So the way to differentiate it is to look at the patient. If the patient is having cough or difficulty of breathing, that is an RSV infection or probably an influenza. But this is actually a characteristic of viral infection. Okay, bird's eye view. So let's go to the laboratory main diagnosis or diagnostic test to detect dengue. Of course, viral isolation is 100% accurate, but it takes 4 weeks for you to have or to grow the virus on your artificial tissue. Okay. Normally we use the duck embryo, and I believe that you eat it here, right? You eat that here, di balut. Oh my goodness. Anyway, PCR, okay? PCR nucleic acid detection is 90 to 100% accurate, but later you will see why it is not considered as the primary diagnostic tool, although it falls under the main diagnostic tools. Dengue, IgG, and IgM, care of and Biorad. We're going to change the supplier for this one, for your IgG and IgM, plus your NS antigen. We will no longer take Biorad, right?
Yes.
We will switch to the other company. Much cheaper, but same results. Okay, so I'm going to emphasize on your NS antigen detection. I was able to discuss to you later the viral parts, right? So the protein E, particularly the NS antigen. So, in short, if you are going to ask me, I strongly recommend NS antigen or the NS1 antigen test. Because the NS1 antigen test, this test really will tell you that the virus is present in the body. Practically because the NS antigen is part of the virus, the viral spike. So no viral spike, no NS antigen, no dengue. Okay? So evaluating dengue tests, as you can see, the NS1 antigen here, where is the NS1 antigen? I think this one, yeah. So you see 100% present, and then it will go down and still will go down. Okay? If you will see the demarcation, it's still 85 to 90% accurate on the last day of infection. As you can see, this line, this one is the IgG-IgM. As we all know, IgG-IgM will increase on the day where the virus is already producing enough damage to the body. Okay? So this one is only good for detecting antibodies most probably. For the PCR, as you can see here, is a PCR. It is 100% accurate because of course the virus is still there, still present. But as you can see, it will go down on the 8th day, primarily because of the self-limiting effect of the body against the virus. There is no specific treatment for viruses, they just go away. That is one mystery virology cannot answer. Okay? You can see, you can compare to this diagram that the NS1 antigen is really quite superior over the other tests. And your RT-PCR or your reverse transcriptase PCR is expensive. Okay? It is not a very good tool of diagnosis if the patient is already on the 8th or 1 week of the disease. Okay? But if you're going to look at the NS1 antigen, see on top, 90, 100, 100 until it goes down to 85%. Still a very high percentage compared to other viral tests or dengue tests. For the management of the disease, supportive, as I've said a while ago, there is no treatment against dengue or other viral infections, with exception to hepatitis viruses, especially C. Hydrotherapy or intravenous fluid, they use the normal saline solution and the D5 or lactated Ringer solution for shock. Okay? Just like me, I need D5LR when I see your T80 fail. H2 blockers for abdominal pain and gastrointestinal bleeding. Okay, so this is your this is used also for patients with ulcer. Okay, the H2 blockers. So if there is gastrointestinal bleeding, there is hypersecretion of your HCl or hydrochloric acid in the stomach, which may lead to bleeding. So your H2 blockers will prevent or stop the stomach from producing hydrochloric acid. That's why H2 blockers block. Paracetamol 500 milligrams every 4 hours. Please never give patients aspirin. Why? Okay, it will promote also bleeding. So paracetamol is the drug of choice for pyrexia. Okay, ingat. Transfusion is also the best way to prevent. Sometimes even if you transfuse, the patient still dies. Okay. So for uncontrolled bleeding, fresh whole blood. Okay. For prolonged PT and PTT with thrombocytopenia, fresh frozen plasma is indicated. Okay. For disseminated intravascular coagulation or DIC, there is platelet transfusion is indicated. My main question is the very, very good question. I already asked this to some of your colleagues. Why does the patient's platelet goes down in case of dengue? Dehydration, no? I don't think so. Why is it that patients with dengue has very low platelet? Why? Why do they bleed? The one who can answer that will be treated in Milan. Air ticket round trip. When you arrive, you leave already. Next flight, Manila, okay, you go there. So why do you think that the dengue virus, or patients with dengue, does it amaze you? Why these patients have very low platelets?
It damaged the spleen.
I already told you that, Maya, right?
No.
Where is? Oh, okay, she left. Anyway, I think I told that to Manel. I asked her why does people with or patients with dengue fever have very low platelet and at the same time will have this complication, disseminated intravascular coagulation, or this is their micro bleeding. So your petechiae are actually a product of your DIC, right? So, platelet transfusion is indicated, which means if you have thrombocytopenia, you will have DIC, right?
Yes.
Since you have low platelet count, that means there will be no, if you have low platelet count, the IC will be present in all veins or arteries. So my question here is, why do you have low platelet count in patients with dengue? Sometimes you have normal platelet. After 2 days, it goes down to 90, and then sometimes much worse, it goes to 20 or 30. Correct? If you have dengue, why? That's the
It
best question
damages
there.
the spleen.
What?
Damages the spleen.
Damages the spleen. No.
Intravascular coagulation.
Yes, that's it. The virus attacks the bone marrow, which is responsible for the development
You're
of
going
your...
to Milan.
Dengue Virus.
I'll accompany
Okay,
this year.
that's a joke only. Milan Street, I saw one Milan Street in Tondo. Anyway, so the virus attacks your WBC. Okay, once the WBC goes to the or circulates to the bone marrow, it also attacks the bone marrow. Okay, particularly, I think you have stages, right, for the development of your thrombocytes. Before it becomes a platelet, there is stage, which I'm not interested in hematology. So this stage until you have the platelets, right?
Yes.
So there's a particular stage the virus attacks. So the platelets goes down. In other viruses, they attack the bone marrow by lowering down the WBC count. Okay, that's why viruses has leukopenia on your, the result is leukopenic in the CBC if you have viral infection. For bacteria, what is the organism that attacks your WBC and bone marrow? When you see this, oh, it's virus. No, I think the segmenters is high. Leukopenic, but segmenters is 90%. Okay? Okay. Your typhoid fever causes leukopenia,
And
but
dengue
you can differentiate
syndrome.
it from virus with your segmenters. Okay, so always remember your patient with dengue, the platelet goes down because the platelets are, the bone marrow are attacked, not the platelet itself, but the bone marrow is infected. Okay, so the development or evolution of your platelet is being destroyed or being altered by the virus because the bone marrow is infected. Global impact. Philippines reported 100%, 148% increase on dengue cases last year, sorry, not this year. Last year, 2011, which resulted in 1,432 deaths in Manila in December, in July alone. In one regional, this is, I guess, 3 regional hospitals. This 1,432 deaths is only for 1 week. Okay? So the magnitude is very alarming, 148% increase. Out of 1,432 deaths, 80% of them are children. Okay? So, as I've said, Brazil reported the first Aedes species resistant, species. They did not mention their Aedes. So, Aedes aegypti. So when you say reported the first species, this covers 2 or 3 species of your Aedes. Singapore reported 10% increase in the number of dengue case this year. Okay, last year, that is last year. So 10% increase. So wala sila sa Philippines. Tayo 148. Okay, future weapons. By 2015, European and American agencies will release the first batch of vaccine against 4 strains of dengue. So there will be a vaccine in the year 2015, tops 2016. Okay, to cover all strains of dengue. But of course, they will vaccinate first their European kababayan and Americans. I think Americans naman. And they will sell this triple to Asia. So that's the sad part, you know. In Europe, they don't have dengue there, but they're the ones developing the vaccine. Okay, Asian countries, Africa or Brazil or Latin America, these are the countries that are hardly hit by dengue, and they do nothing. Okay? So the Europeans are the one developing the vaccine.
Because they have the resources.
I'm sorry, we have the what?
They have
We have the resources.
They have
No, the European company responsible for the development of vaccine, but this vaccine is Germany and Belgium. Okay? An effective viral drug against the NS5 protein coating that is responsible for viral replication is on phase 3. Clinical trial will be approved by 2019. So there will be a drug, okay?
Many people will die
What?
for 20,
Many will
2019.
die, of course.
Before
you will be
2019.
Okay? So the NS5 protein is responsible for viral replication. So if you destroy this, the virus will not replicate, and the rest will be up to your WBC. Okay? So 2019, it's already in phase 3. One more phase, it will be approved by the International Committee for Drug Use. So we all know a good mosquito is a dead mosquito. So there will be no dengue, no mosquito, no dengue. Okay? So this one is this picture is the band name in Brazil. They call themselves dengue fever. I don't know why. Because this lady, 3 of her children died of dengue. When she became a singer, she dedicated her songs to dengue fever research. Okay? Any questions? Okay, we go home now.